Thanks so much for that, Dennis. On that note, we're going to take a quick break, come back. But here's a reminder of my guest tonight, because we have, you and I and all of us have a lot of questions for my guests. And these are the experts when it comes to coronavirus. Dr. Koinange, he's the AMREF Health Africa Group CEO right here next to me, and we're keeping our social distance.
Exactly. How many meters is it?
It's a 1 and change.
I have a sanitizer just in case.
Okay. Dr. Mercy Mwangangi, CAS Health, and Professor Omu Anzala. He's the virologist. This is the expert here.
This is the guy
University of Nairobi.
Yes.
Thank you. Thank you. The University of Nairobi. Folks, thanks so much for coming on, because there's so much skepticism out there. And Dr. let me start with you real quick. People, they're not taking this seriously. In fact, we have some pictures from Gikomba Market today. Should we play those pictures? Asha Mwilu, chief investigative correspondent, was in Gikomba.
Right.
And take a look. When it comes to social distancing, it doesn't exist. Look. Look.
Yep.
Everyone's greeting each other. They're checking out Mitumba stuff, camera, whatever they call the camera. Is that a? Okay.
Yeah. Don't say it. Yeah.
Yeah. Okay. Doctor, people don't believe this thing. They think it's a movie.
This thing is real. Let me just put it this way, that there are many diseases out there. It's not only corona that we are worried about. There are so many. The health system, the doctors, the health workers, the Ministry of Health, there are still other things we are addressing. So this is just one of those other viruses, like any other that we have. The only challenge with this one is that it's highly infectious, highly contagious, and we know that a good percentage of people, 2 out of 10, if you have huge numbers, might require extreme care in the hospital, ICU and those kinds. That's why it's caused a lot of attention. But it does exist. We have 7 cases in Kenya now, confirmed cases. Yeah. We don't know whether there are others out there that have not been confirmed. When you say there are 7 cases, you're basically saying these are the 7 cases that we know, we've tested, and they have turned positive. That's what we are saying, but it is actually there.
But Dr. Mercy, if I could go to you now, 7 cases so far, but people, I guess critics, they're saying it's a lot more than 7. It can't just be 7. And that's what people are saying out there, that you people are not telling us the truth.
Right.
What do you tell people?
So, Jeff, one, this is real, and there's need for Kenyans to be proactive. The Ministry of Health indeed confirms that we do have 7 cases, but it's important to note that these people have had contact with people in the community. And so are we saying that there are only 7 cases right now? And the answer for that would be, we are working on it to find out, because we are tracing these people, trying to find out who did you come into contact with, where do you live, where are the places that you might have engaged with people in the community. And then through robust testing of these contacts, then we will be able to determine what the true number is. But Jeff, the focus should be on trying to prevent transmission of this disease. And as you've rightly highlighted, social distancing is important. And perhaps what we need to do is have these discussions in our communities and explain what that means. What does social distancing look like when you're in a marketplace? And I've seen good examples. I've seen supermarkets like Tesco in the UK actually putting pacers when you're in the line, in the queue. That's what we need to be concentrating on. When you do get a positive case, there's some good news. 80% of patients actually have mild symptoms. 80%.
Professor Anzala, let me ask you this. I once watched a movie called Apollo 13, and the one line I remember from that movie is the astronauts up in the air, when things went really, really wrong, they said, "Houston, we have a problem." Do we have a problem, Professor?
We have a problem. We have a problem.
Yes.
All right?
Yeah.
Yes.
You see, and part of the problem was a miscommunication, the rumors, the wrong information that was communicated at the beginning. When this infection spilled over from the animal to the humans and started off in China, and then everybody thought it was a Chinese problem. Then eventually we started seeing the outbreaks in Europe, Middle East, and then slowly it moved north to North America. And then in the process, everybody was saying, oh, Africans are what? Yeah,
yeah.
new, isn't it?
Strong gene.
What about us?
We have strong
What
genes.
about-
Yes, exactly.
Correct.
Total myth.
Total myth.
This is a totally new virus.
Yes.
Yes.
Human beings have no experience with this virus. When we looked at the demography and the whole issue, why Africa is coming last is a volume
Of trouble. Yeah.
of travel. Volume of travel. I wish, Jeff, you can have a picture just to show the volume of travel. Look at Europe, look at the Middle East, Asia, look
And
at North
America,
America,
yes.
and then look at Africa. Africa is a dot here and a dot there.
I see.
Again, if you look at it critically, you will find that the first countries in Africa to get an infection, Egypt,
North America, North Africa.
volume of
correct.
transportation,
Algeria.
and then South Africa.
Exactly.
And then now slowly you are beginning to see cases come into it. We knew that.
Yep.
It was just a matter of
Time. Oh my goodness.
Totally new virus. Volume of what? Air transportation.
Okay, hold that
Yes.
thought, Professor, and all of you, because I'd like to ask, why Italy? The question I've been asking is why Italy has been the most affected in Europe. Think about that. And then how bad is it going to be? And then I'll let the viewers ask the questions because it's not about me tonight. It's about Kenyans asking you all the questions. Okay, we'll take a break. In the meantime, Mariga. Okay. We're going to take a quick break. We're talking to the experts right here. It's all about Corona. Everything you need to know. The call-in line is 0719 777 SMS line 22422. Stay with Citizen Television. These folks are the experts when it comes to Corona. Ask your questions and ask them boldly. Jeff Koinange Live takes a break. We'll be back in a moment.